Second it.
All approved? Aye.
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 Any opposed? Okay, let's move right into it then. So this is, I'm sorry, go ahead. So this is the first meeting where we have a little Q&A in the first 10 minutes that looks backwards to previous presentations for additional questions and follow-up. So I'll turn it over to the floor. Perhaps, Jeremy, you want to start? I know you've been the one who's waiting the longest since the meeting, I think 2 meetings ago. So why don't you go ahead and kick us off?
Yeah, no, I appreciate that and for handing it over to me. So I have a question for Jeff about the projections of student enrollment. And so I do a lot of like sophisticated analysis on projecting future outcomes and impacts of policy decisions. And so a lot of the times I like to take a step back and like look at what the actual output is and just kind of do like a common sense test. Is that making sense? And so the thing that kind of struck me is how over the next 10 years we think that student enrollment in Howard County schools is going to remain flat. And I wanted to dig into that a little bit more. And, you know, Howard County is such a desirable place for families to live. And as we're growing our housing units and growing our population, it doesn't seem right. It doesn't pass like my initial smell test that like the student enrollment is gonna be flat. And I know so much of the, you know, the growth is going to be multifamily, and that doesn't yield as many students. But and that makes sense to me. But like I think if you think about a little bit like holistically, like will there be trade-offs by adding these housing units? Will it mean that people essentially shift to different housing types and opening up housing units that attract more families, like specifically single family detached housing through our growth? And so I guess the question I have is, I guess, and what I've understood from past presentations is that we're using the past data and the past trends of the past several years to predict the future. And I think with single family detached, I would suspect, although I don't think we've seen the data of like what the actual last couple of years of data is of resale of single family detached homes, but I would suspect that has been down over the past several years, given such high interest rates, given the pandemic. And I'm curious, are we using those past couple of years of data to project the future, and does that make sense? So I guess that's my question for Jeff, if you could opine a little bit more on that.
Sure, I can opine a little bit on the school projection methodology. Of course, the school system is really the source that projects the student enrollment. Our role is to give the school system housing unit projections. And you had sent an email asking for that data. We can certainly share that data. So every year, annually, we update our housing unit projections for the next 20 years based on location, based on what we know is permitted and what's in the pipeline, what DPZ is reviewing, and also what's in the you know, the zoning capacity. So we could certainly share those projections. It's the last 10 years, it's been around 1,500 units, housing units per year for all unit types. That's slowing and has been slowing lately. So that the next 10 years is slower, but it's still going to be between 500 and 1,000 plus units a year over the next several years. So number one, we can share that data for you for sure. And regarding the student projections, that's one of the inputs that goes into the school system projection model. There's a really good description of that, and I think Tim might have shared it. We could also share it with you. It's actually it's in the school section of HOCO by Design. It goes into detail of the projection methodology in terms of, you know, the concepts. Basically, it includes new construction, which we provide, what DPZ provides to the school system. It includes an estimate of student turnover from resales. And to get to your question, yes, it does only look at past trends. So basically, it's on a school district by school district basis. So there's 70 plus school districts in the county. and it analyzes each school district on the last few years' history of net new students from resales, because some neighborhoods have the natural tendency to turn over. As you mentioned, families moving out and or maybe empty nesters moving out and new families moving into these single family detached units. So it tries to capture that based on trends by neighborhood. And it is based on the past. It doesn't try to project into the future based on the factors that you mentioned, such as, Howard County is a desirable place to live. So therefore, people are going to downside and more families are going to move in, that kind of thing. So it's not predictive, but it is based on empirical evidence of what's happened the last 5 years, or I think it's 5 years. And then it's updated annually. So if the trends change over time, this kind of rolling 5-year does get updated annually. So that's the second factor. And then the same thing they do, school system projects, is estimated net new students from apartment rental turnover. So the same kind of thing as housing resales. They look at the typical apartment turnover. They track the students. They know if students leave the school system, and they know as new students coming in. But again, past empirical evidence. And then the other major factor is the cohort survival. They know the class size of fifth graders. So then they know, next year that how many sixth graders are going to be in the school system, taking into account sort of the natural progression of students maybe going to private schools at that time or vice versa. So they basically have natural, and again, based on trends. It's based on what's happening currently. And they also know how many students are, that are third graders. They know what's going to show up in fourth grade for cohort survival. And then the other factor is birth decay ratio. So they look at birth rates. Now, it is puzzling. I agree with you. The fact that the county has grown, but the last several years, it's dropped from 2019 to 2020, and it stayed flat and it's not really increased, and they're projecting it to stay flat. This is really the first year that projection has been made. And if you recall, Tim had presented a really great chart that showed their estimated projections for the next 10 years over the last 5 years. So basically, there was that chart that showed, they overprojected for the last several years. And it was a difficult time to do projections because of what happened with the pandemic and the kind of the shock to the system with that. There was expectations that students would come back, and they haven't. So, their latest projection does show up being flat based on all those factors that I mentioned. So, we can certainly share with you the housing units, and that is one factor that adds to the mix.
Yeah, no, thank you so much for that. I mean, it kind of confirms my skepticism that looking at the past 5 years and given what's happened over the past 5 years with high interest rates and the pandemic, that using that to predict the future just doesn't seem right to me. But I understand that's how it's being done from your answer right now. So I appreciate that.
Right.
It helps me understand better.
Okay.
And one more quick question. I think annually, DPZ provides to the school system like a list of all new housing development. Is that public? And if not, could you make that available to the public or to this committee?
So that is public. So that's actually part of the APFO legislation that was added recently. When the school system forwards the annual school capacity chart to DPZ, we pre-file it on behalf of the county. Part of that package not only includes the school capacity chart, but includes a list of projection, all of the projects in the pipeline, basically.
So it like names the actual developments,
Names,
and
it's
where
the whole
they're
list. It's a whole
located
list.
and the
Yeah,
size of all
it's
of
a
it. Okay,
list of.
I'd love to figure out exactly
Yeah,
where the link is so I could look at that in more
Yeah.
detail. Awesome.
Hey,
We can
hey,
work-
Jeremy, going back to your first question for a minute, looking backwards data and then looking forward projections. One of the public safety slides tonight, I don't know if you've reviewed it yet, that I thought was quite interesting was, and correct me if I'm wrong, Sean and Major Ben, but something on the order of 60% of the population growth in Howard County the last 10 years is the senior population. 60% of Howard County's growth is the senior population. So that's pretty striking. I had never heard that before, and that seems to probably, it goes to the point of we're still growing, but we're aging as we're growing, and the population growth is an aging population, not a school age population. Secondly, I think, Jeff, it was you last year that presented this spending affordability, or perhaps it was one of the economists that looked at U.S. Census Bureau projections for the county for the next 20 years. And their estimate for the school age population of age 5 to age 18 was flat. So it's not just the school system that's looking at projections. That's an independent outside source. I thought that was pretty striking as well, and almost shocking, because I had the same impression as you, Jeremy, coming in, that as the county grows, we're going to add new students. In fact, that hasn't been the case the last 5 or 6 years, because the county growth is not school age growth.
This is Aaron. I guess one question I have is, are you tracking the students that bleed out of the public school system into private schools? So, I mean, do you know what the school age population is in the county, and has there been a shift from public to private as a result of the pandemic?
Well, one of the things that Dan Lubley, I think it was Dan Lubley last session or the one before when he presented, said that the capture rate of eligible 5 to 18 school age population has gone from almost 96% down to 92%.
Yeah.
Meaning that the public schools are only getting 92% of the eligible students, whereas historically they've been getting 96. That was one of the reasons why we talked a little bit about why or whether we're seeing a capture rate of incoming kindergartners closer to the 96, meaning we're reverting to the norm, or are we still bleeding down into the 92 range? I don't know if there was data on that yet, but
yeah, I mean, that's interesting for me, because just anecdotally, I know a lot of families in my neighborhood that were frustrated and moved their kids to private school. And some have started to shift back into the public schools now that we're a couple of years removed from the pandemic, but others haven't. And so, in another 5 years, you might move back closer to that 96% capture rate, that we haven't seen the last few years.
So
Lisa, I
Todd,
see a hand. Oh,
yeah, so
go
Todd,
ahead.
we have a big agenda this evening. We have
Yes,
Lisa
I'm
that's
sorry.
been
Yes,
patiently
yeah.
waiting, Brent that's been patiently waiting, and then also Mr. Casagrande sent a pre-question that I just want to answer, and then we will post the pre-question and the most recent question up on the webpage with some of the additional information as part of our meeting information, so we'll add that to it. But we do have the police, fire, and hospital here with us tonight. So if you just want to get through these two questions, I think then we can also time at them for discussion, but these are really important discussions that we're having. I don't want to cut them short. We can definitely have them at a future date, but also we have a lot of people waiting to present to you their great information as well.
Linda, are you going to post those questions and we're going to just defer and look at them in the record, or?
No, I'm happy. Well, let's take the two questions that are here now. The question that we had from Aaron, I was just going to read that out, and then we're going to post that to a section in our meeting information, if that works. Just, additional questions and responses from our meetings as part of that meeting record.
Okay.
Sorry, so do you want me to ask the question, or are you?
No, I thought Lisa was going to ask her question.
Oh, Lisa's going to read
it.
Okay.
Brent had his hand up as well. And then I will go ahead and read your question, since you've already sent it to me, with the response that we have from the schools.
Okay.
Okay, I guess that means Lisa. Yeah.
I'm sorry,
yeah.
I'm trying to pull up 3 screens at one time.
Oh, I'm sorry. I figured she meant you. Thanks.
So Linda, this is the question that Aaron sent us, correct?
Yeah, I'll go ahead and read that. Lisa Markovitz had a question, so if she can ask that question to the group, and we can see if we can answer it tonight. And then I believe Mr. Lovelace had the question next, and then I'm going to go over Mr. Casagrande's question, and then we need to probably move on to presentations.
Okay, Lisa Markovitz, it's you.
Okay, thanks. Sorry, I wasn't sure which one. Anyway, this was a question because of something Jeff said. So Jeff, please, can you let us know if the data on new students that come to the school system new and that are deemed from new construction, And we've been told that that is from occupancy permits of the prior year. Is there anywhere in your projections for student enrollment where a new student into the system from, say, a 2-year-old home or a 3-year-old home or a 4-year-old home, still relatively new, but not brand spanking new, is there anything that would capture that in those projection criteria that you mentioned, or no? Thank you.
So I think that's really a question for the school planners, because they do those projections. Again, we provide the housing units to them. Having said that, they do include birth decay ratios, and so I do think there's, as part of that methodology, they look at like 2 and 3-year-olds. But I'm not 100% on that. So I think it's really a question for schools about how they do that. I do know, getting back to the question said before, I just received information from the Baltimore Metropolitan Council, who updated their cohort model, and so they now include 2020 census data and birth rate trends from 2015 to 2020. Birth rates have been slowing. Their projections, as Todd mentioned, do show that the 5 to 19 population in Howard County going down, and so that stems from lower birth rates that's happening in Howard County based on health data and really across the country. Now, having said that, again, that's past trends, right? So it still begs the question, as Jeremy mentioned, how do we know it's going to stay that way forever in terms of people moving to Howard County, et cetera? But I'm just saying that's one of the explanations why I think it's remaining flat, because I know the school system just updated their data also with the latest birth trend information. So if births are low, then they're not going to end up in the school system in 5 years. So Lisa, I don't know if that helped. So it's really a school system question about that particular methodology.
So what we can do is, if you want to send that in writing again, I'll go ahead and email that to Tim and have them answer, and we'll have that for you for the next meeting, add it to our questions.
Okay.
All right, I think, Brett, there was one more from you, and then the red one from Linda.
Thank you. To Jeremy's point, yeah, regressive testing of populations leads to different results. We've all discussed what potential rezoning is going to do to the county, especially like Columbia Gateway, large projects such as that. And we just had a housing committee meeting just a few days ago that's seeking a lot of repeals to APFO controls, which quite honestly are only a burden when you have inadequate infrastructure. But I guess the question is, if we have all this aging population and lowering of students and outsourcing to private schools, how many trailers are we attaching to the public school system presently, and how long will it be till it's zero? Anyone can chime in on that one.
Yeah, I think that would be, again, more appropriate for the school system. We can't really anticipate what their game plan is for trailers, whether they're being used in a manner for students or for some other type of mechanism within the schools. So that would be a great question to send to me, and I will forward to them, and they can respond to you.
Thank you.
And the group. Yep. So really quickly, the 2 questions that were pre-submitted were from Mr. Casagrande, and I will go ahead. So what we're going to do on the webpage where we have our meeting information, we'll create another tab in the binder that are pre-submitted question and answers and resource materials, and you'll see them in order in which they were received in that back section. But just so you all know what was sent to us, and that way you have the information for your records, and we're also meeting the open meetings requirements. The first question was, how are students and spaces for special ed and pre-K regional programs reflected in the capacity charts? Basically, board approved capacity formulas dictate that for elementary schools, special education and pre-K spaces are not currently counted toward capacity. These spaces provide program for students that are in specialized programs and sometimes require special facilities. Due to the regional nature of these programs and unique enrollment requirements, these students are not part of our standard enrollment projection either. Enrollment estimates and space requirements are part of a separate annual process in coordination with the administrators of these programs. Rooms utilized for these programs are deducted from the capacity calculation. reducing the overall K through 12 capacity in order to account for the needs of these programs. And I think one thing we can also do if you have additional clarifying questions is when we go back to make these recommendations, when we get through this learning period, we can bring back Tim Rogers again to have these discussions more in depth as well. And then secondly, also, is it possible to get the capacity charts that cover the period from current 2024 to the 27-28 school years? As far as that, he can tell from the materials, the capacity charts skip these years and only reflect projections starting in 27. And so the response was, this information is very similar to the data in the post measures chart and the 23 feasibility study. So pointing that toward that reference point. The only difference would be the timing of construction projects. But if we're only focused on 24 through 27, there would be no change. School system does not include it in the APFO school capacity chart because it's prior to the test year and therefore not relevant to the school capacity test. So again, we'll post these responses, questions and answers for you all.
Thanks, Linda.
All right, thank you.
So let's move on to the rest of the show tonight. Deputy Chief Allagher is here from Fire and Emergency Services, and I'll turn it over to you.
Hey, good evening, everybody. I hope you're well. Hope your families are well. With me tonight is Miss Danielle Goodwin. She is our data analysis manager. First couple slides I'll address, then she'll drive the bus most of the rest of the way. Danielle, are you ready?
Yes, I am.
All right. Waiting for our presentation to come up.
It takes a minute. So just Danielle should have rights now.
Am I just not seeing it?
No, I'm not seeing it either.
Danielle, are you able to share your screen?
I am trying to. Hold on one second. Let me see.
Is the final presentation that you submitted to us the one that you'll be using this evening, or did you make any changes? Because if not, we can share from the webpage. Okay.
That is correct. Yes, it is. Yeah, it's
Okay.
for whatever reason it's not
All right.
wanting to load.
Okay. All right. Lisa, can you run that, or do you want me to? If we can just share from the webpage, then that might be the easiest.
Yep, I'm bringing up right now. Can everyone see my screen?
Yes.
Yes. Perfect.
Yes. It's very small, though. If it can be increased, that would be great.
It will be in just a moment. Give me 1 second. Is that better?
It works for me.
Yep, that looks good. Thank you, Lisa.
Welcome.
All right, Lisa, if you're driving the bus, you can go on to number 2, please. The Howard County Department of Fire and Rescue Services is a department of 600 uniformed career personnel and almost 200 operational volunteers. We respond to incidents from our 14 fire stations, which we'll review that in a couple minutes. And we provide these core functions to the community with a goal of maintaining a safe environment, high quality of life in Howard County by educating, protecting, and serving our citizens, members, and visitors. While we're here, do you guys have any questions about the core services, or would you want to address it at the end? Okay,
The
we can move on.
agenda calls for questions to be answered at the end.
Okay, fair enough. All right, next. You can move on, Lisa. Thank you. So what's new? Since the last process, the AFO process took place, we've opened 2 new fire stations, Station 12 in Waterloo at Route 1 and 175 and Station 14 in the Meriwether District. 2 fire stations have relocated, Station 1 and Station 4. We've increased staffing at our Lisbon and West Friendship stations. And when I say that, we went from a couple of people on shift work there every day to a total of at least 6 working every day. We've added 1 daytime ambulance. We call it a peak load unit that's in service from 7 a.m. to 7 p.m. And we anticipate that probably by the end of November, we'll have a second. When we talk about opening a station or adding a new service, it's a significant commitment from county government. When we open a station with just an engine and an EMS transport unit, that requires 27 people. Station 12 was almost $16 million in construction costs. And for purchasing new apparatus to go into the facilities, the fire engine will probably cost you about $1 million, and that is just the engine itself. It doesn't count for the hose, breathing apparatus, radios, computers, any of that goes into it. An aerial ladder is about $1.5 million, and you should expect to pay about $500,000 for an ambulance. And we can move on, Lisa. So just a quick overview of how we provide the service that we do. The engines and ambulances are the workhorses of the department. We staff all of our engines with 4 personnel. The aerial ladders, we refer to them as towers or trucks. I may use that term interchangeably if it comes up in this presentation. We staff them with 4 as well. And our EMS transport units are staffed with 2, one of which may be a paramedic. Across the department, we have 14 staffed engines. They carry between 600 and 1,000 gallons of water apiece. They carry several attack lines, typically 200 to 400 feet in length, and supply line, which is typically about 1,000 feet of 4-inch hose. And to differentiate between, they do pretty much what they say they will do. Supply lines are for water supply. Attack lines are the hoses we use to put fires out. We staff 3 ladder trucks around the clock. They carry hydraulic rescue tools, saws, portable ground ladders. They function as search companies and ventilation companies on fires. They also function as what we call a RIC company, rapid intervention. If there's a firefighter hurt or injured in the course of their duties, they could deploy to effect a rescue or remove that firefighter from an unsafe environment. We staff 14 paramedic units around the clock, 2 BLS units, and then we have the peak load units I just mentioned. The tankers, the water haulers, it's the lower left picture. In Howard County, we staff 2 of them, and they carry 3,000 gallons of water apiece. Our volunteer partners have 3 of their own tankers in addition to their own ladder trucks or own EMS units. So we've got a pretty good fleet that we deploy on a daily basis. You can move on, Lisa, please. So hopefully nothing gets lost in translation with the loss of the PowerPoint we had put together for you. But the initial 6 fire stations in Howard County were all volunteer. And over time, we've added career staffing to all of them. Today, we're a thriving combination system where we work, the career side works side by side with our volunteer partners. During the day, there are 114 uniformed career employees on duty and 112 overnight. Station 14 in downtown Columbia was built through a partnership with Howard Hughes. It was initially intended to be a quick strike station in the growing Meriwether district, But through the development process, the department was allocated space for a full service station. We deploy engine 141 and paramedic 145 out of there every day. And Station 14's proximity to Station 7, we'll talk about this again in a couple slides, but its proximity to 7 allows us to relocate Station 7 to an area that we better served by a new fire station than simply rebuilding it on the site where it exists today. And with that, I will turn this over to Ms. Goodwin.
Okay, I'm going to actually try to share my slide. Let me try to see if it actually works. It wasn't working before. Let's see. It is not allowing me to share. Great. Okay.
Does it give you an, Danielle, does it give you an error message?
It's literally not, hold on one second.
If you select share, if you choose screen as your first option, it should come up.
Okay, so screen, let me see if I share it, and then
It's working.
Yay, there we go. The reason why this is important because there's a visual to this. So and it doesn't look as nice on a PDF versus a PowerPoint. So let me go to the next slide. So my name is Danielle Goodwin. I am the data analyst manager for Fire and Rescue. And we'll go over some data points and how we kind of do our station locations, resource allocations, where we put things based on our outside, based on various factors. So first, I'm going to show you our 2010 incident density map. This is our past density map. So this is where you see the red spots. Those are what we like to call our hot spots. This is where you can see the largest concentration of where we are responding to calls. And as you can see, we have very specific hotspots that we are consistently going. And that's in 2010. And then I'm going to go to this past year. So this is what it looks like. So from 2000, I'm going to go back to 2000. I haven't even shown that one, but in 2000 to 2023, our incident volume increased by 65%. And then from 2010, what you just saw, to now, it increased by 27%. And we'll go into more of why that is. But as you can see, we have the downtown. Let me get the laser pointer. We have the downtown Columbia area. We have this area up here. This area up here is our Northridge Road area. That's a lot of aging population. There's a lot of aging facilities up in that location. We've had a lot of development in Turf Valley. So if I go back one, you will see that that's not lit up, but now it is. And then you can see where Station 12 is. We've had a lot of development there. We were working on Station 12 for a while. We got it in. And this is extremely helpful because while I don't have a map of it now, because in essence of time, this area in Station 12, our time was extremely low. Like it took us a long time. It took Station 1 or Station 6 to get there. And it took a long time to get there. So luckily, by putting in Station 12, we've actually have had less, our response times have improved during that time. I'm going to go to the next screen. And the next screen is our future. So this is still the 2023 incident volume map, but we have some plans in the works. So we have Station 15 up here, where the Chief Alliger, if I'm correct, it's where this headquarters of the school is located.
Yes.
Yeah. We have a planned station there. We're finalizing those plans, and that is going to be built at that location. We are then relocating Station 7, as you can see, right in a direct hotspot to that location, because as Chief Alliger has already mentioned, having Station 14 where it was and having Station 7 there, it doesn't make a lot of sense. And then we have Station 16 that is up here where we are, there's a lot of growth happening in the Turf Valley. It's growth, and it's also that our times are not, our response times are not as good as they need to be in that location, given also the population. And one of the things about how we have structured the station location in Columbia, in downtown Columbia, is that we tried to triangulate it. So we have a response time issue right in this area here. While the volume is not that great in this area, the response time is probably one of the worst response times in the county. So anybody that's located here, we don't really have a good mechanism to get there. So by locating Station 15 there, we have, this will drastically improve our response times, but then they can also get down into downtown Columbia, the hospital, and then we have Station 14 where it's existing, and then Station 7 being located in one of our additional hotspots. So a lot of what we try to do is obviously incident volume, but we're trying to strategically also look at how we look at response times, also population growth, and all of those things. And I'll go into that on the next few slides. Chief Alliger, do you have anything to add?
No, ma'am, you actually covered everything I was thinking about bringing up.
Okay, great. So this is just another map. So this is just a difference of the number of responses from the year in 2010. So taking the snapshot in 2010 and then taking a snapshot in the end of 2023, and how many responses we've added. These are what we call our box areas. It's a good way for us to be able to say, okay, well, which box areas are we adding incidents to? So as you can see, where we've added the Waterloo Station over here, which you can see is a high 554 new responses or incidents in that area. That's significant. And then when you look at downtown Columbia as well, also you have down in the southern part around Route 1, Ellicott City, again, we have some aging facilities here. We also have some age restricted housing in this location, but also just generalized development in this in Turf Valley. So you can see how the development impacts our responses, and we take that and we look at that and we try to plan to put the stations in where that development is happening. So this is just a graph showing our responses. The blue is our responses. The orange is the county population. Just like every other service in the United States and across the world, when COVID hit, we actually saw a decline in our responses. People were not calling our services due to the fact that there was quarantine. People were not willing to go out. They were being advised to stay home unless it was a life-threatening emergency, which you would think in some respects they would call 911. But in this situation, people really were apprehensive about doing so. So you could see that our volume has been increasing. It's been increasing since 2000, but in this graph, it's 2010 all the way up. We got a decline, and it's moving back upward. And I can tell you already that 2024 will surpass 2023. So as you can see here, from 2000 to 2023, our incidents increased by 62.8%. The residents increased by 35.6%. And then in 2010, it was 27.1 to 17. And so a lot of, this is a lot of times you would expect to see that it should be kind of similar to the growth pattern of residential growth, but we don't just service residents in Howard County, and also we service those that have more vulnerable populations that might utilize our services more. So we service anybody that comes into Howard County, whether they're employed, whether they're passing by. We have a lot of thoroughfares, 95, 70, 29, 32, any accidents that occur. If they're visiting, we've had a lot of development happen around Merriweather. So all of these things increase our incident volume. And then I'll go into the next one, kind of shows the same thing, but just a little bit different. This is our incidents per 1,000 residents in Howard County. As you can see, we have the dip in COVID, and now we're back up, and it will continue up that way going forward, or at least I can say for 2024. Chief Gallagher, anything you have to add to that?
Nope.
Okay. So going forward, factors impacting incident volume and fire and EMS service delivery. Our factors are aging population, employment. As we build up our commercial volume, as we continue to build these things, we have more of an influx, and I'll go into more detail, of people coming into the county that do not live in the county, and they are still people that we serve. We have just our residential population. As I said, it's and as you can see, it overlaps county development and an outflow of traffic. That includes through traffic, people that are not even coming into Howard County, but go through it. And then we have other factors. We have environmental factors, floods, tornadoes, whatever it might be. We also respond to mutual aid, and we have hospital wait times. All of these things impact our services, and there's even other things but those are kind of our major things that can impact our service delivery and incident volume. So I'm going to just go into the population. As you can see here, we have the 2010 population, and then we have 2023. 2010, there's definitely more of a triangular shape to it, and 2023, it's boxier. Boxier tends to indicate that what we typically know as the younger supporting the older, now we have this boxy looking shape. And that means that service delivery, again, changes from who we service back in 2010 to 2023. And then here's our population increase in Howard County. I just broke it out by age cohort, basically by looking at what this is just coming from the census data. 0 to 19, then kind of our working age. Yes, there people work 60 and older, but just based on how we can break it out. And then 60 plus. 60 plus, we've experienced almost a 30,000 more residents at 60 plus. Aging population contributes to majority of what I would say are our increase in our population, which they are more vulnerable, as we all know, as we get older. That can definitely have a significant increase on how we deliver service and how much we deliver that. So then we're going on to who we actually service. So both EMS incidents and transports among 55 and older have increased in the past 10 years. So we, unfortunately, data we only have till 2014 based on based on the provider that we have. So back to 2014, between 2014 and 2023, 55 and older have increased by our patients of 47%, while transports among 55 and older have increased by over 32%. Patients 55 and older comprises an average of over 55% of the EMS incidents in our department from 2014 to 2023. From 2014 to 2023, an average of just over 81% of the incidents involving patients 55 and older resulted in transport, compared to an average of 70% of patients less than 55 who are transported. So this is just looking at our own data and also seeing kind of that same trend of, as we're aging, our services also increase very similarly in that manner. And when we're planning, this is what we're taking into account. And so, as I said already, that we service anybody who comes into Howard County, whether they live here, whether they work here, whether they're visiting, whether they're passing by. So just to give a little bit more, and this is what we take into consideration, we also look at traffic patterns. We look at, we need to make sure that we have stations along our major thoroughfares. And so when we look at our EMS transport billing for this past fiscal year, 64% were residents and 36 were non-residents. So they may have come from another county, wherever, but they were not Howard County residents. And this just continues to show that whoever comes in, we service. It does not matter. And then I'm going to keep going because I know we have time, limited time. Outflow of workers. So our outflow of workers, almost 50% of Howard County residents travel 10 to 24 miles to their place of employment. 38% travel under 10 miles. 14% travel more than that. Residents traveling outside of Howard County to work nearly travel, 48% of them travel to Montgomery County, Baltimore City, Baltimore County, Anne Arundel County, and then we have PG, Washington, D.C., and then it's just dispersed. Essentially, what this is that we have a constant influx. We have people, the car accidents, all these things. As we have people moving throughout the county, we are constantly having, we're servicing them. And you'll see the next slide that you'll see majority of people that work in Howard County do not live in Howard County. So over 75% of those who work in Howard County live in other counties across Maryland, Pennsylvania, Virginia, and further. Only 24% of workers in 2021, that's the latest data that I can get, live and work in Howard County. It was higher in 2019, but the pandemic, as it has with many things, dropped that number. So I would highly expect that would increase again. And this, again, where you can see 64% of workers commute from, and I'm not going to go through it, as you can read that, and majority of the 13,000 additional workers coming from Montgomery County, PG, and Anne Arundel. So one thing that I noticed is that Howard County workers they're either going to Montgomery County or they're going to the city, Towson, they're going to the Baltimore area, versus those that are coming into Howard County are coming from the south. So traffic patterns also matter to how again, it just shows that we are constantly having an influx of people coming in and out of this county. And that's what I have. And I'm sure there's a lot of questions. I wanted to present so much more data, but that's what I got for now. So, Chief Gallagher.
Appreciate your time with us tonight, and we look forward to talking with you after the other presentations.
Anybody want to jump in, or should we move along?
Yeah, Todd, we have to follow the agenda, which says questions are at the end, because we all approved that and said yes.
Okay, that's fine. So let's go to Major Ben, and the next few minutes are yours.
Thank you for the time. My name is Major Terrence Penn. I'm the Deputy Chief of Administration with the Howard County Police Department. And how are we going to get my presentation up?
Okay, so if you select the share button at the bottom, and it'll give you a whole bunch of options, but select the very first one, which is screen.
Okay. Let's see if this works.
There you go. You're up.
Okay, cool beans. Slideshow. Sorry about that. So, I guess this is a little. Okay. Is it right?
Yes, if you go all the way down to the bottom of your screen, there's like tiny little icons, and there's one that looks like the one to the far right looks like a screen on a pole. If you just click that, it'll go right to a PowerPoint presentation.
Is that it?
It hasn't changed yet. Give it a second.
Oh, it was captions. What about now? Can you see it?
If you
Major
just
Ben,
click from the
actually-
beginning in the upper left-hand corner, it'll present on your whole screen.
Sorry, I was just going to say that. Thank you, Mr. Brown. Yep,
That's
just
the
hit that
one.
button.
Right here?
The from beginning, you just had it. You were just on top of it. Just click that.
I just did. And can you see the presentation?
I might have gone. Do you have dual screens?
No.
I mean, we see
I
the
can see them.
presentation, just not in presentation mode.
You said what?
It's not in presentation mode. We can see your presentation, but it's not in presentation mode. So therefore, we see all of the notes and your
Okay.
sidebar.
If you go to the top there, at the very top of where like you can save it, where the disk is, if you just hit that, like, yeah, there you go. That should work.
Is that it?
Should work.
All right.
Yep.
Okay. Did it turn?
Or from beginning, just from beginning, it's not working. Even if you do the from beginning.
I clicked from beginning.
Huh.
Let's try it again. I'm sorry. Stop.
Yeah, I mean, for the sake of time, I mean, we can see your slides, so we can just probably keep moving on.
All right. Cool beans. So let me try to get it. There you go. Okay. So, all right. So again, I'm Major Terrence Penn, Deputy Chief of Administration. So this is a presentation in reference to the APFO. So a little bit about the Howard County Police Department. We have we cover 251 miles. We're comprised of sworn animal control officers, civilian administrative personnel, auxiliary officers, volunteers, and interns. Our mission is to provide a sense of safety and security for everyone by protecting life and property, reducing the opportunity for crime and disorder, enforcing criminal and traffic laws, assisting victims, and promoting positive community engagement and effective partnership. And then we've been accredited since 1990. The leadership team for the police department comprises Chief Dar and Major Speck, Janowicz, Baker, and myself. Again, you got the APFO is a process in which growth is managed through to ensure adequate public roads, schools, and facilities. One of the ways that we, as the police department, I try to address that we are providing adequate services is through some of these particular variables. Ensuring that we have adequate officers dedicated to patrol based upon density. And then because Howard County is very vast, there are some heavily populated spaces or dense spaces, and then there are some less dense spaces. So making sure that our beat and patrol configurations match the need of the communities. How we measure success is by response times, similar to the fire department, and then also crime rates. So the state, we try to be, our goal is always to be below the state average. And the way we do that is through funding and, being adequately funding and leveraging technology and software. In 2024, our adopted goals and objectives are listed here. First one is enhance agency responsiveness by making full use of the recently approved patrol strength increase and reduce response times to priority 1, calls for service. Continue implementation of all previous and newly passed and updated police reform legislation. Build upon community engagement by pursuing strong partnerships with a wide variety of community organizations. Invest in improved technology of personnel in all areas of the department. Continue focusing on competitive recruitment, training, retention, and the highest caliber candidates possible. Strengthening the department's technological capabilities by evaluating current systems of suitabilities and any upgrades or replacement needs. Emphasize officer morale and mental health with recognition that officer wellness is closely related to job performance and attrition. And lastly, conduct a comprehensive review of HCPD's fleet, assess with a view towards fuel saving, decreased carbon emission, and less downtime maintenance cost. Our organization is broken down into 4 commands: Field Operations Command, Special Operations Command, Criminal Investigations Command, and the Administration Command. The Field Operations Command, which are the patrol districts, are broken down into Northern and Southern District, which also we have the Community Service Bureau, which is our community outreach section, and that is our community policing, community outreach section, and our crisis intervention team. We also have the Youth Division, which is in the community engagement, the Community Service Bureau. Our criminal investigation component is broken down into 2 bureaus, major crimes and special crimes. And those 2 commands house 14 sections. Our Special Operations Command is broken down into 2 sections: Special Operations, which is our emergency response TAC team, K9, special support, traffic management, and then operations support, which is operational preparedness, and our forensic service division. Our patrol, as I stated before, our county is broken down into 2 patrol districts, Northern District and Southern District. Southern District is the most densely populated of the 2 districts. And then this is our updated beat map, which we updated which is 2024. And this particular map, it shows your not only just how the district breakdown, but also the area of responsibility. Prior to the 2024 map, we were using the older map was we used into 2019, which shows how big how much the Frank area was as opposed to if you look at this one, the Adam area. As I stated, one of the things about ensuring that we provide quality service is call volume assessments. Call volume assessments is determined to make sure that officers have equity as it relates to answering calls for service. This particular slide illustrates 2023, 2024 calls for service, and you can see roughly all of the calls are evenly distributed aside from the Adam area, which is landmass large, but as it relates to density, person density is not there. And then this is broken down, the call volume assessment broken down by district. Southern District, we decided to house all of Columbia in Southern District so that when somebody living in Columbia, when they reach out to the district commander, they're not, depending on what street they live on, they won't be speaking to two separate commanders. So Southern District Columbia houses all of Columbia, which is some of the reason why there's a Southern District has greater call volume. So in this particular for call volume, the big three calls for 2023 were calls to department stores, discount stores, parking lot garages, and residents or homes. In 2024, our three highest call volumes were highway, roadway, streets, parking garages, and homes. This particular slide illustrates the crash data. In this particular slide, we are looking at Route 40 and Route 1. Basically, you see over the past 12 months, these are the two beats that have a great deal of calling. You can see the hotspot along Route 1 and Route 40. This is, again, Southern District. This shows their hotspots, and it's around Route 32 and Route 1. No, I'm sorry, 175 in Snowden. As it relates to crime stats, you can see that illustrated in the purple, Howard County is below Maryland State violent offense reports, and we are also below for property crime as well. The goal for response time to respond to priority 1 calls for service is 8 minutes and 14 seconds, 80% of the time. This slide illustrates our response times. Again, some of the ways that we address response time is through beat configuration, monitor the impact of beat configuration on response time, and adjust resources and beats as needed. We try to adhere to the national average, which is 2.4 officers per 1,000 population, and we monitor and address vacancies to minimize patrol shortages. Of course, we continue to provide training, high level, and understanding the importance for call takers, the call taking process, and police response, and understand that those two, the 911 call, along with the police receiving the call and responding to the call, all work in concert with each other. excuse me. Again, this is our response time. First quarter of 2024, 7.7 minutes and 5 seconds. And second quarter, 8 minutes and 60 seconds. Our staffing, we have 509 sworn members. Civilians, we have 236. Contingent, which are part-time employees, we have 97. And we have 9 auxiliary officers. So the process to be hired as a police officer is the hiring process, which is the application, physical, agility, background, medical, psychological. It's between 3 and 6 months. Once you successfully complete that process and you're selected, you attend academy, which is an 11-month process. So it takes roughly 14 to 17 months for someone to leave, to apply to be a police officer and be able to replace a retired officer or officer that resigned, which is one of the reasons why we our recruitment strategy is so aggressive. Because in order for us to have quality candidates, we have to move very quickly to get applicants through the process and select them before other agencies attempt to capture our candidate. So this is a chart, staffing versus population growth. This table just illustrates if we adhere to that 1.06% population growth, what the number of projected officers would need to be. Here is a graph showing the number of sworn officers that we have to the projected population growth. Currently, our visible footprints are Northern District, Ellicott City, our Southern District, which is in Fulton, Oracle Building, Columbia, Outreach Building in Columbia, our Public Safety Training Center, which is shared by Police and Fire in Marriottsville, and our Communications Building. And then we have satellite offices in Hoppers Choice, Long Reach, Owen Brown, Oakland Mills, North Laurel, Elkridge, and Glenwood. And then this is a map showing where our stations are and our satellite offices, to include animal control. So right now we are exploring the possibility of a third district, which is consistent with Holcomb by Design, and expanding animal control. Thus far, a feasibility study has been done to build on that location, on that site rather. Right now, we've implemented the drone program, which is a great program to help us search for missing people and suspects. It has been very beneficial since we've been using the program. And the way that we are able to accomplish our objectives and mission is through adequate funding. And as you can see, each year our budget has had a significant increase. And I conclude with how we're able to work in concert with county administration to meet the goals and performance measures that we have. And that concludes my presentation.
Major Ben, thank you. Thank you very much. I hope you'll be able to stick around in case there are questions momentarily once we go through our next hospitals presentation. But with that, I will welcome Andrew Nicholas and give you the floor to talk about the hospitals.
Thank you very much. Can you all hear me and see me okay? Yes.
Yes.
Great. Excellent. Thank you very much. Appreciate it. I'm also, so my name is Andrew Nicholas. I serve as the Senior Vice President of Government Affairs and Policy at the Maryland Hospital Association. I'm joined this evening by Brandon Floyd, who will be sharing our presentation. Brandon's a Senior Analyst at the Hospital Association on the Government Affairs and Policy team. Pleasure to be here with y'all. Brandon, do you want to go ahead and bring up our slides?
Sorry, Andrew, can you hear me? Yes.
Yep, I got you.
Okay, should be coming up right now. I'm just pressing the share button. Not sure if this is the same challenges that others had, but I'm clicking the share button and it's not.
So when you click the share button, it brings up several options. You want to choose the one that
Yes.
says screen.
Yes. So I've selected that one. I've clicked share and not sure if you all can see my screen.
Not
No.
yet.
Not yet.
Okay, I'm not sure why. So I click the one that says screen and clicking share. I'm not sure why this is not sharing. Try again.
I'll give it a shot too.
Okay. It's like the blue button to click share is available, but when I select it, it's not transitioning to share mode.
Okay, I think, is my screen up?
Yes. But you're just seeing
All right.
the attendee screen, so you just need to put your presentation on that screen.
Okay. How's that? Is that working now?
No, you just undid it. So what you do is you
Give me a
share.
second. Okay.
Sorry, everyone.
You have sharing power now. So if you select the share button at the bottom of the screen and then select screen and then select share on the bottom right.
Okay. I think I might, if I switch over to this.
Ah, bingo.
Okay. 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 So. All right. Is that working?
Yep, we can
Everybody
see you
can-
perfectly. Thank you.
Wonderful. Okay. All right. So yeah, again, we'll just walk through this. We were asked to come give a little overview of hospitals and hospital capacity, and we'll finish up talking a little bit about what's going on within emergency rooms across the state. But just briefly, starting off, the Maryland Hospital Association serves as Maryland hospitals and health systems through collective action to shape policies, practices, advancing a performance to advance health and healthcare for all Marylanders. That's our mission statement. We have over 60 members all across the state, all different. We have academic medical centers, we have rural hospitals, suburban hospitals, community hospitals, all different sizes from fewer than 50 beds to some hospitals with over 1,000 beds. So work together with all of them to advance field-wide priorities.
All Maryland hospitals also are not-for-profit institutions. We do not have any for-profit hospitals in the state of Maryland, and no public hospitals, all private hospitals, not-for-profit. And this just gives shows you how we're spread out all across the state, truly from Western Maryland all the way to the Eastern Shore and everything in between. So hospital capacity, we have a lot of state oversight here in Maryland, and so hospital capacity is primarily overseen by two different state agencies. The first is the Maryland Healthcare Commission. They're an independent regulatory agency whose mission is to plan for health system needs, promote informed decision-making, and increase accountability and improve access. One of the key things the Healthcare Commission does is the state health plan. And that's an overview of sort of the current state of Maryland healthcare access and then what is needed. And they divide that up by different areas within healthcare, from hospitals to behavioral health, et cetera. Another key aspect of the Healthcare Commission is they oversee the certificate of need process. And hospitals are required to obtain approval of a certificate of need before they expand capacity or services. And so this requires hospital to justify the need for the expansion or the care that they plan to provide. And the sort of high level reason for this, it avoids a race to the bottom in regards to quality. Healthcare is not something that you won't necessarily want too many folks providing to where the quality is deteriorated. So it's trying to balance access with quality. The other state agency that oversees hospital capacity is the Health Services Cost Review Commission. This is another independent state agency, and their primary responsibility is for regulating hospital reimbursement rates and ensuring the financial stability of hospitals. So Maryland has a unique in the nation healthcare reimbursement system, and have, through some version, have since the 70s. But this sort of current iteration that we're in goes back to 2014. And the HSCRC sets what is called hospital global budgets. Hospitals are on a fixed income. More to come on that in just a moment. But as far as capacity goes, to expand capacity, hospitals must get approval from the HSCRC to be reimbursed for those additional services. So you can, if you set up, additional floors or expand your beds beyond what you're currently licensed for, you need to go to the HSCRC to get an expansion of your global budget, because they set hospital rates and budgets. So on that, the model that we are currently operating under is called the total cost of care model. And this is an innovative healthcare payment approach that's designed to improve the efficiency and quality of care while controlling costs, primarily for Medicare beneficiaries. It is a Medicare demonstration project, but the thought being, it is an all-payer model, so it is, what's good for Medicare beneficiaries would also drive down costs for everyone. And so a key structural component of the total cost of care model is the global budget system. And so this allows hospitals to receive a fixed annual budget set by the Health Services Cost Review Commission that I mentioned earlier. And so rather than being paid per service and per encounter and based on the volume of patients you see, this is a fixed revenue model. And the thought behind that is to encourage hospitals to prioritize preventative care and manage chronic conditions effectively, and essentially attempt to keep people out of the hospital, avoid readmissions, and then even go upstream, make investments in preventative care. The goal of the model is to reduce unnecessary hospitalization and improve the overall health outcomes in our communities. So regarding emergency departments, it's no secret that emergency departments in Maryland, are impacted by very long wait times. This is not a problem unique to Maryland, but it certainly exists across our state. And it is something, though, that Maryland hospitals and a number of stakeholders are invested in and are trying to improve. There have been a number of different efforts, There are a number of different inputs to this problem, so that it is really not an emergency room problem or even just a hospital problem, but also a issue across the full continuum of care. So getting folks to move through a hospital and then into post-acute care. Again, the preventative piece has having access to primary care and things on the front end play a role as well. However, so hospitals are taking a lead in trying to improve the situation in Maryland. The Maryland Hospital Association led a General Assembly formed hospital throughput work group just last year. This was at the request of the chairs of the House Health and Government Operations Committee and the Senate Finance Committee in Maryland. It was comprised of General Assembly members, hospital leaders, providers, allied health stakeholders, so emergency room physicians, nurses, other specialists, the post-acute providers, primary care providers, as well as public health advocates, members of the community. This was convened in July 2023 and ran through January of 2024, and they were tasked with analyzing the healthcare workforce. Healthcare workforce is a big component of this. There is a significant needs in the healthcare workforce across the nation. We were always kind of running into this issue, but the COVID pandemic certainly enhanced it and exacerbated the healthcare workforce needs. And so that task force was looking at ways to augment and supplement our healthcare workforce, health system capacity, post-acute care options and availability. Our partners in the post-acute space are also dealing with the same workforce challenges that hospitals are. And then changes in acuity over time in hospitalizations and ED visits. This is something that we've seen, I think, more so since COVID, is that the patients that we're seeing tend to be sicker and needing more care. And of course, if somebody's sicker and needs more care, they spend more time in a hospital. That impacts throughput and the availability to get people into and then out of the hospital as quickly as you could. So those were some things they were looking at. They did issue a very robust report that came out in March of this year, identified a whole host of issues and opportunities for improvement across the full spectrum of care, and that has been taken up by a number of people to try to advance those opportunities. The Emergency Department Dramatic Improvement Effort, or the EDDI program. This is an HSCRC quality improvement initiative that began in June 2023. So this is that Health Services Cost Review Commission I mentioned earlier. They've stepped in with this EDDI program to help improve emergency department wait times and throughput. There's rapid cycle quality improvement initiatives to meet set goals related to ED throughput and length of stay, create a learning collaborative among hospitals, and this was convened through the Hospital Association. Also, enhanced reporting on emergency room throughput and efforts to improve. So there's monthly data reporting, and that's led by HSCRC and the and MIMS. And last but not least, there's the newly formed Maryland ED Wait Time Reduction Commission. So this is a new commission that was established during the last legislative session, and it is designed, it's chaired by both the Maryland Department of Health and the Health Services Cost Review Commission leadership. And the commission will develop strategies and initiatives to address factors throughout the healthcare system that contribute to increased emergency department wait times. It includes diverse representation from MDH, MIMS, the Hospital Association, hospital administrators, clinicians, and policy advocates, and behavioral health professionals. Behavioral health is a key aspect in all of this and how we handle behavioral health patients. There's a link there to the commission website. They just had their first meeting earlier today. I'm fortunate enough to be a member of this commission representing the Hospital Association. And it is my hope, and I believe you'll see, that this commission has a 3-year, at least for now, operating timeline, and that this commission will take up many of the recommendations that came out of the work group last year and to see their implementation carried out, and to really make improvement in this space. So getting a little closer to home, just wanted to talk briefly, of course, about your local hospital, the Johns Hopkins Howard County Medical Center. They were founded in 1973, and they are a member of Johns Hopkins Medicine. They specialize in women's and children's services, surgery, cardiology, oncology, orthopedics, a whole host of psychiatry, emergency services, and community health education. They have 232 licensed beds, and their sort of snapshot of their the patient care that they provided in 2023, they had 75,000 emergency room visits, 28,000 outpatient services, 20,000 patients were admitted or observed. They did 8,000 surgery, and they delivered 2.5 thousand babies. And so Howard County Medical Center is leaning into this emergency room issues as well, like all Maryland hospitals. They have opened a discharge lounge. It's one of the strategies many hospitals are using to try to improve hospital throughput and improve emergency room wait times. This streamlines the discharge process for patients who've completed treatment. So it gets patients out of the bed, and while they're sort of waiting for paperwork or waiting for transportation, it frees up that bed sooner, and they can wait in the discharge lounge while those last few steps are being completed, so that that room can be turned over more quickly. They've also added additional outpatient capacity. There's behavioral, adding additional outpatient capacity does help decant folks from needing to necessarily go to the hospital. They can access outpatient services more quickly without needing necessarily inpatient care, and potentially even accessing some preventative care. There's behavioral health unit opening in December that will increase beds available for this service from 6 to 24, so a significant expansion of access to behavioral health care coming later this year, and planning for a new observation unit for patients who need short-term treatment or are still under evaluation. This unit will also help decant folks, from the emergency room who need additional observation or more times needed to assess their status while determining whether or not they might need to be admitted or need some other level of care. Again, freeing up space, helping folks move through the hospital, making sure their needs are being met in a timely manner. So those are some of the things that are going on right here in your local hospital in Howard County. With that, I think that is my last slide. I'm happy to answer any questions about any of that. I'll go ahead and stop sharing so I can see everybody again. Did I successfully pull that down?
Thanks, Andrew. But let's open it up. Anybody have a question or a thought to share?
Yeah, I have a question.
Go ahead, Lisa.
Thank you. Mr. Niklaus, thanks for that information. I have a question about the Certificate of Need program process. Are submissions to expand and or increase numbers of beds, is that data or those applications publicly available information? And then the second part of my question is, how long does that process usually take when a request is made? Thank you.
Sure, absolutely. Yes, it is public. It's on the Maryland Healthcare Commission's website. You can see all of the applications that are currently under review. You can see all of the applications that have been reviewed and the decisions that have been made therein for at least the last several years. They've got a pretty good archive available online there. And then happy to follow up with direct links if that'd be helpful. And then the review process it can depend. Because essentially you submit your application in a former career. I led the application process for one of the hospitals in the state, or health systems in the state, and then there's a series of questions back and forth with staff, and so they will ask questions until kind of they feel satisfied that the application is complete and they have the information needed to then make a recommendation up to the commission. So I will say I think you're looking at a minimum of 6 months, but more likely closer to a year-long process. But it also depends on the size of the project as well.
Thank you.
Four hands up in order. Paul, you're next.
Thank you. I appreciate all the information on hospital growth and the current ED backups. Are there any efforts being made to promote alternative sources of emergency services, urgent care centers, and is there any regulation around those?
Yes, so the Maryland Department of Health does have the Maryland Primary Care Program. And so that is particularly geared for the Medicaid population and expanding access to primary care in that population. There is not necessarily the MHCC. I'm 95% sure about this, but they do not have direct regulatory authority per se over the proliferation of primary care offices the way they do, for hospital-based services and things. But there are also a number of other sort of incentive programs to encourage partnerships between health systems and community-based providers to share resources to help support those operations. I can get you.
Just a quick follow-up question. Do you have any data? Do you have any data to suggest that the ED backup problem experienced in Howard County is any worse or better than at other hospitals throughout the state?
Sure. We've certainly there's data out there that kind of depicts what the experience is throughout the state, and so we can look into that and we can share that with you as well. And so yeah, I think I can say pretty confidently you're not alone. But happy to see what's available and share that as well.
If you have comparative wait times, that would be great. Thank you.
Thanks. Antoine, you're next.
Good evening. To the three presenters, thank you all very much. First off, very comprehensive. I was probably most impressed, or at least most inquired. Danielle and Major Ben, you both gave kind of almost overlapping maps of incident response, service quality amongst your respective districts. And I can imagine from the hospital presentation that layover of data is very similar. But my question lands on on the respective personnel needs. I don't so much hear so much of that. Major Ben talked a bit about officers needing about 18 months, from start to finish of the application process to get on board. How has retention, and either of you three can speak to this, how does retention of staff affected level of care or level of service? And is that a part of the metrics that were shared tonight?
So for fire, we typically take about a year to get somebody hired through the academy and then into a firehouse on shift work. And I would tell you from my experience as the assistant chief of field operations, as the pandemic unfolded, there was not a lot of turnover. The workforce, but I can try to get you specifics if the group wants it. But anecdotally, I would tell you there was not a lot of turnover in fire. We have a commitment to staff the department every day with the staffing levels that I talked about, even if it requires paying overtime. And for a good chunk of my time in ESB, we were able to do that. Staffing and service rarely suffered. Not to say that there weren't some challenges through, I think it was the first of the Delta or Omicron surges, but those tough days came and went, and we resumed our normal service.
Okay, thank you for that.
From the police department's perspective, I think it's the same. Our challenges have more to do with the uncertainty of police reform, not necessarily a pandemic. And I think, the challenge with the policing is it takes 18 months to replace a person. So we're always behind the 8 ball in that regard, because of how our process works. But we're fine.
Okay. Sounds good.
But thank you for the question.
Thank you. It's good to see numbers behind the folks who hang out on my side of North Laurel.
Brett, you're next.
Thank you. This is a little awkward with the layout for questions, but I'm going to ask all three components basically the same question. We started this meeting on yellow alert with hospitals. We're currently on red alert for over half an hour here. And on the hospitals, you do fall under a state license. We do have the General Assembly working on things. We actually have a House bill group working on funding that may work on competing priorities. But typically the charts region, the hospital wait time is a metric that we pay close attention to. And the same question I'm going to ask 3 times in a row is what growth tests or mitigation would the hospital system entertain in order to ensure adequacy? The same goes for the fire department. You have a transfer tax that just got chopped down a bit. You shift between operating and capital on your fire tax. And you have NFPA metrics out there. They're beautiful for response time. And we haven't seen a detailed, mind you, response time mapped in over a decade in our county. And what metrics would you want that could ensure adequacy along with planned growth? And lastly, police. Police, you've made it very clear that your needs grow proportionate with growth in the county. You have some metrics you cited, 8 minutes and 14-second response time and 80% of the time. You have shops, you have cars, you have buildings, you have a lot of capital expenses. And again, and your drones are about to be banned by Congress. So you're going to have a big drone purchase here shortly. What growth tests would you entertain as well, or mitigation in order to ensure adequacy for the county as we grow? Thank you.
Well, wait, so you said hospitals first. I'll jump in first, I guess. So is this, so I guess just to understanding the question, is this relating to sort of well, first I'll say the hospitals don't control their own growth, right? That's overseen by the Healthcare Commission and the HSCRC, and they have their own metrics by what they evaluate us. Sometimes they agree with what we perceive to be the need, and sometimes they do not. But if you're sort of asking as it relates to the county APFO process, I'm simply not expert enough in that process, and I would defer to sort of I know including healthcare and hospitals in that process would be fairly unique in the state, but I would defer to sort of the discussions with like county attorneys and whatnot on that.
Thank you. And just for reference, the last APFO committee about 9 years ago, we were told absolutely impossible. The county can't fund capacity expansion for the hospital, and it has. So we're definitely looking again, since we've shown that we can do that. Could we do that in our APFO metrics? Thank you.
Want to go to fire next? Go ahead.
Okay. So we can work to produce some response time statistics for the group if you're interested in that. But to answer what I think is probably your big question, I don't think fire wants to be a part of limiting growth. There's other county agencies that have more of a role in that than fire does and should.
Thank you. Please.
I think the response time piece, I presented information, and I think we make a distinction between priority 1 and priority 2. Priority 1 are in progress emergency calls, and then priority 2 are non-emergency calls, which we respond to routinely. So the 8-minute and 14-second goal is for priority 1 calls, not all calls for service. As it relates to your question surrounding a test, we have no desire to participate in that particular process. Our goal and our objective is to make sure that we are accomplishing our mission and objectives.
Fascinating. Thank you.
Okay, Laura, you are next up.
Thank you, Todd. I just take my hand down here so it's not up anymore. Okay, so I have questions for all 3 presenters, and I'm enjoying getting this information. And I also want to share with everybody that I'm trying to put something together from a real estate perspective, because I get a lot of data for the Mid-Atlantic region, not just Howard County. And we got a lot of information last week, and I think you guys would all be surprised where Howard County falls in the Mid-Atlantic region when you see some of the data. And I think it's gonna just exacerbate the situation where people are coming into the county because there aren't houses here for them to buy. So I think that whole pattern of traffic back and forth and people coming here who are getting services we're paying for or what have you, I don't know, that might get worse, but I'm gonna put something together that'll get looked at and shared, but not before the public meeting next time. Okay, so first of all, with the hospitals, what I've heard is that a lot of the problems with the capacity have to do with the fact that a lot of the people you're serving really need more behavioral help and not physical help. So I don't know how we in the APFO committee can, calculate that and figure out like how does that work. But what I've been told by some of our council members is that yes, it's capacity, but it's also the type of capacity. So I don't know what your answer would be to that. The other question that I have is for the fire, because in the slides that came in the email, there was a slide that wasn't in this presentation that said something about station number 17, which apparently is just a discussion. So I'd kind of like to hear a little bit more about that. And then also for the police, I would like to ask, does the aging population affect the police in a similar way as it's clearly affecting our fire department? And what is it we can do, if anything, to help make that better? And lastly, for everybody, which we'll discuss at the very, very end, or hopefully at some point in time, the agenda that we're having for the public meeting, I haven't heard anything about that. And we don't have another meeting between now and then. So can we start with the hospital?
Certainly. Thank you for your question. Behavioral health access is a major issue across the state and a key component when you think about the wait times in emergency rooms and delays in hospital throughput. No doubt about it. It's extremely challenging. There are when you alluded to, it's not just capacity, but the type of capacity. That is absolutely right. Particularly in the behavioral health space, where you'll hear people in the hospital industry say, a bed is not a bed is not a bed, because not one type of bed is necessarily going to be good for every patient. It can depend on the individual diagnosis, any sort of comorbidities or co-occurring disorders that are also associated with that patient. Maybe they're appropriate to be around other people or not. So that does make that particular issue very challenging. However, at the end of the day, I think it's widely acknowledged and accepted by everyone. We need more capacity in the state for behavioral health care. And that's, community-based care to help avoid crises. That's crisis response care that can help, intervene when someone is having a crisis and more quickly get them stabilized. And then that is, that your inpatient care. So it's across the board. I know this is something that was part of the MHA work group that looked at this, recommendations related to expanded capacity, and the need to examine that. And then it is also from our first meeting today, something that the ED wait times, statewide ED wait times commission will be looking at specifically. And so while it is very challenging and there are a lot of inputs and factors to consider, I'm hopeful that we're on a path towards establishing, towards expanding capacity in the short term and establishing a plan to right size capacity in the long term.
Thanks. And my next
And,
question was for
go
the
ahead.
fire department, Station 17.
Yes, ma'am. Good evening. Station 17 it's been discussed briefly for like the, I think it's the Dayton area. But right now we're focused on the relocation of Station 7, the North Columbia station at Station 15, and then the Turf Valley area station 16.
Okay, thank you.
You're welcome.
The next one was the other question was the police, the aging population.
Thanks for the question. For us, it's a little different. The aging population, really, we don't have the same exposure as fire because we're not providing medical services to the degree that the fire department and EMS will be providing services. We tend to deal with the younger population and those motorists. So it's not the same.
Right. So you're saying that most of your resources then are geared more towards the younger population and people traveling in and out of the county. Right. Is that right?
We as it relates to medical calls for service, yes. Only the thing we engage with our senior population is fraud. And we have a senior liaison or community liaison that we go to senior centers to discuss crime prevention, fraud schemes, theft schemes that target our senior population. But as it relates to calls for service, we don't get a whole lot of calls for service that we are primary on. That's typically the fire rescue.
Thank you.
Thanks, Laura. Jeremy, you're next.
Yeah, great. Thank you all so much for these presentations. Super informative. My question is about the fire and specifically the fire stations and the relocation of Station 7 from what is, I guess, currently like Banneker to potentially a location, if I'm looking at the map correctly, like on Cedar Lane across or near the Hickory Ridge Village Center. And so I'm curious, like, I guess one of the rationales is because that area has a high density of incidents, and this would put that station right in the middle of it. Could you talk about like what causes a higher density of incidents, and like in that location specifically? I'm familiar. I think there's a shopping center, there's a church, there's a urgent care center, and I think there's a assisted living facility. So I think I know which one of those probably is causing it, but I just would love to hear a little bit more what specific types of development are leading to the highest amount of incidents.
Fair enough. Danielle, are you able to speak to this?
Yeah, so I will say that the incident volume, when you see the map, they are typically aging facilities. They are age restricted housing. So when you see those hotspots that you saw in 2023, even in 2010, you will see that if we plotted that on a map, and you will see that those facilities, it is age-related facilities that are bolstering our incident volume increase typically. Not to say that other generalized, not to say that there are not other things that increase that. Any other development, large developments can also do that. But in that specific location, yes, let's say that specific location is more along the lines of we respond to that location. If I stand corrected, and I could get you the numbers, but let's say that this past year it was 700 or 800 times this past year alone. So,
And to be fair, there are several facilities in that area that probably fall into that category. So just to say just one of them, is probably a little unfair.
So when I make these maps, it uses a radius, a specific radius, but I do know that it uses a radius. But I can say in general, that is definitely a driving force in that specific location. But you go to downtown Columbia, and obviously downtown Columbia, there's other reasons why that's also a driving force. So.
Excellent. Thank you.
And Jen Mallow. You're muted, Jen. You're muted.
Thank you. Two things. Isn't the North Columbia Fire Station, Station 15, going to be at the Board of Ed building behind it?
I think we're still trying to work. Bear with me. Sorry about that. I think we're still trying to work out the specifics on where on the property it is. I'm kind of new to my role, that I don't know if I know the ins and the outs about where specifically the fire station is proposed to be.
Okay. Since Jeremy Damu thought it was potentially located near Hickory Ridge Village Center, I don't believe it is.
I'm sorry.
Station. Go ahead.
So if you don't mind, can you ask the question again? I was a little distracted on my end when you started posing it.
So Mr. Damu asked if he thought the North Columbia Fire Station was going to be near the Hickory Ridge Giant. And is it not? I thought it was supposed to be at behind the Board of Ed building.
So the Banneker Fire Station, what we refer to as Station 7, the Banneker Fire Station, is being relocated near the intersection of Hickory Ridge Road and Cedar Lane. The North Columbia Station, Station 15, is hopefully going to be located on or near the headquarters building for the Howard County Public School System.
Okay, yeah, just to jump in. So I was asking about Station 7, which is currently at Banneker, and the information they presented today is they're planning on relocating that to Hickory Ridge and Cedar Lane. So I wasn't asking about the one on the Board of Ed, or proposed for the Board of Ed site.
So with Banneker, or Banneker 7, right?
Yes.
Okay. And that is going to be at Hickory Ridge. Do you know where at Hickory Ridge?
Pretty close to the intersection of Cedar Lane and Hickory Ridge Road. At least that's where we hope.
Okay. Then what is to become of the original Banneker station?
That I don't know.
Okay. Because I thought the original plan was for it to become senior housing on top of a renovated fire station.
I know I've heard that talked about, but where that process stands right now, I genuinely don't know.
Okay, because that will make a difference in terms of population, and if they're going to put a fire station back at that location. Okay, thank you.
And thanks, Jen. Anyone else? I'll ask one question of police and fire if nobody else has anything. So as the age demographic continues to increase in the county, do we expect fewer police calls per resident and more fire calls per resident? Is that kind of what I'm hearing in your presentations tonight?
I can't say that we expect fewer police calls because we have more police calls this year than last year, more police calls this year than the year before, 2 years before. So I can't say that we'll have less calls for service. I think we have to, realize that, the county is very transit, and with the increase of the county, we get a significant amount of calls for service during the day. So I don't see a decrease in call volume because of the residential population shifting demographic.
And how about from the fire perspective? Does the age demographic impact fire calls?
I'll defer to Ms. Goodwin.
Yeah, so I mean, yes, I would say that again, similar to police calls, I mean, we've seen the increase that is continuing to happen. We had the decline during COVID, but yes, as again, fire and rescue there's a multitude of things that impact it. Vulnerable populations, police, or not police, aging population, any developments, all of those things impact who we service because it's whoever comes into the county, similar to police. So I would say the expectation is, the trend is, as you could see on the one graph, that it will increase, that our volume will continue to increase over the next few years as people continue to age and as we have additional development and development from elsewhere elsewhere in other counties as well. So.
Okay, thank you. Anybody else? Or should we turn our guests loose? Go ahead, Laura.
Yeah, I was gonna suggest that we, if everybody's willing, say goodbye to our guests and thank them for coming and maybe take a minute to talk about the public hearing that's scheduled for the next meeting because there is no meeting between now and then.
Yeah, I tend to agree with that. And I have one kind of broader issue to put in front of the committee as well. Anybody else? Okay. All right, well, let's thank our guests for this evening. Incredibly helpful and it's just been very instructive for me and I'm sure the rest of the committee. So thank you so much for coming. If we have any additional questions, they'll probably come to you through Linda or Lisa and Lisa Kenny. But thanks again for coming out this evening.
Thank you for your time.
A pleasure. Thank you. Take care.
Thank you.
Bye.
Appreciate you.
Likewise.
Laura, that's a very good idea, and I think we should do that. I do want to just raise one issue and get a sense of the committee and see where we are. It's come up a couple of times, both tonight and in previous meetings, and it's maybe more of a nuance than reality. But I personally, I feel it's important to recognize that, from my perspective, the purpose of APFO is to give our elected officials time to deal with the growth and then to make decisions that balance various operating and capital demands in the county, because resources are limited and it's our elected officials' job to make decisions on how to allocate those resources. And rather than thinking that APFO is going to deliver the resources that solve all of the problems. I mean, it's a resource issue and it's a resource allocation issue that elected officials have to deal with, not APFO. That's my perspective, and I may be off, but I'd throw that out to the committee and ask you to, if you have any thoughts on it, I think we should share them, because I think we need to be on the same page from that perspective. Otherwise, we're going to be all over the place with what we're trying to accomplish with APFO. Go ahead. Go ahead, Deb. I'm sorry. Oh, I'm sorry, Lisa. I'm sorry.
Oh, okay. So yeah, APFO can't create money. I mean, it weighs in a bit with fees, but you know, we've had a deficit there for a long time, and it's like literally impossible to catch up with just that, right? So you know, of course, your point is well taken. That's a huge factor with the part of APFO that makes things halted is to give time, like you said. But then there are other things in APFO that we're going to be discussing that have to do with decisions on what constitutes a measurement where the weights are supposed to apply or not apply. So it gets a little more nuanced than just time in a general sense. For instance, you've got elementary schools at 105, middle at 110, and high schools at 115. And if those capacities are such, then the weights apply. And so, you know, there's going to be debate about what level should be considered the level at which these weights apply. And something I hope that we do talk about is some possibilities of differentiating from an all or nothing number. I hope we can get into talking about even, you know, the degree of overcapacity having some effect on things. So yes, Todd, excellent points, but there are nuances within that. Thank you.
Yeah. Any other thoughts here? Yeah, go ahead, Brent.
I think we're going to fundamentally disagree, but if you look at the history of APFO across from when it was founded in New York all the way down through the state of Maryland and other counties, you're going to see that the intent of APFO or the spirit of APFO is to ensure you have adequate public facilities as you plan growth. You can use time, you can use financial mitigation, you can use restrictions, you can use a lot of different mechanisms to try to come about that. But the ultimate goal is to ensure you have adequate. And part of that is defining what is adequate and then making sure you have the resources in order to make it. And it's painful. I know the real estate community doesn't like it because it's targeted pretty squarely on their shoulders. But that is the mission or objective of this regulation. And the closer we get to actually providing adequacy, regardless if we grow fast or slow or the economy goes down, that's the expectation, at least of the people that I've been asked to represent. Thank you.
Well, and I want people to jump in, but none of us represent anybody but everybody. We all have various interests. We all have various backgrounds, histories, experience within the county. But we're here to do the business of the county, not a specific interest group within the county. And our job is to try to balance and understand that, but not represent anyone, because we're not here to represent. I think we're here to deal with the challenges of managing the growth and giving the county the opportunity to manage that growth and to deliver public facilities. The challenge that I see is that 90% of the county's revenues come from two sources that are that have nothing to do with APFO control. It all has to do with general funds generated in the county, and that's income taxes and property taxes. The last 10% is a whole variety of fees, including some fees that are generated by APFO and required by APFO. So the ability of APFO to generate funds is there, but it's limited. And I don't know that the attempts in the past have been as successful as the county had hoped with respect to generating revenue that can provide additional public services, both capital and operating. But I see hands going up again, and I'll go to Antoine first, and then Brent, I know your hand's back up again.
So I deal with people who live on two sides of biases on a regular basis. People who like to make decisions for others and people who like to make decisions for everybody. I deal in empathy, if you will. So Todd, I hear you, if you will, if that makes sense. I don't know, and judging from, I think it's only Lisa and Brent who've done this previously. That us who haven't been here before aren't coming into APFO, at least at this juncture. I want to say about this 2-month-ish juncture with our respective, here's why you were invited, here's where your ears are hearing things first. I think the goal, yes, is that we enable our elected officials to make the best decisions possible with XYZ constraints. I'm not sure that all of us can do that right now. I think, and I really kind of leave this on the goodness of the quality of the educational sessions that we've had. We're getting a lens of pieces that are outside of individual perspectives that will allow us to be able to kind of stretch outside of that. I don't think that means right now you're probably going to hear, or we're going to probably hear things that don't have that bias from time to time. But I do think that we will get to a space where we will see things in agreeance and in disagreeance, because we're going to come with our respective, hey, this is what we would like to see, even though these are decisions, the frameworks that have to work for all.
Brent, you were back up next, and then Laura.
Well, I appreciate your comment that the PTA Council is a special interest group. I am very proud that they voted me to represent them throughout these. But I actually wasn't appointed here because of that. Probably because of the work I've done with them. But I was individually appointed. I'm very concerned about all capital expenses: fire, police, water, sewer, environment. That is not just a special interest group. That's a viewpoint of somebody who's been here for generations and have seen the county in action for generations, and where we're going and where we're going to. Thank you for your comments on that. I know we all have our perspectives. I have a very strong perspective, and everyone is free to talk to me either at our official meetings or individually on these topics. Thank you.
Thanks, Brent. Laura.
Thanks. So first of all, Brent, I just want to say, I don't know if you took the open meeting certification, but we're not supposed to talk to each other about these things outside of these meetings. So again, I would just say, please be careful what you're discussing with other members when you're not in a meeting. So just keep that in mind, please. If you all do decide to talk to each other ex parte. I love this group. I think everybody brings something different to the table, and I think that's why we're all here, is because we are all different, and it is our differences that will, bring us to a good conclusion. What I am concerned about at this point is we do have our first public meeting in 2 weeks, and there is no meeting between now and then. And I wanted to ask Linda or Lisa, are you guys putting the agenda together for the meeting? I don't want to go to the first public meeting and we're all sitting there with no idea of what's going on. And if we're all coming here as members, I don't want to show up to a meeting where we're going to interface with the public and I have no idea what we're expected to talk about. So when are we going to get the agenda for the meeting for the 6th? Like what's happening?
Absolutely. So do you mind if I go and answer that question, Chair?
No,
Yeah.
please do.
Yeah.
Please do.
Okay, so the idea is this is a public hearing, so there is no interaction or engagement with the public. We will be having this at the 50 Plus Center, the new one off of Cradle Rock. This has been posted in the newspaper. It's been posted via the Ball Bulletin. It's been posted on our webpage and various social media advertisements, as well as every meeting we've had here. We've been announcing, hey, guess what, everyone? November 6th is going to be the public hearing. So what we will do is you will establish a call to order and welcome everyone for attending the public hearing. You will tell everyone that you're accepting comments on the adequate public facilities ordinance. If you want to give a little bit about what that means, and you'll be taking comments from them, you'll call the hearing to order. We will have you sitting at the front of the room. Let me get back a little logistics. We will have you sitting at the back of the room with chairs in an aisle and microphones set up. We will have a timer. People will pre-register. I will call them up in an orderly manner to come up and give testimony to you all. You will hear from them, and then when their time is up, they will walk away, and a new person will come up to the microphone and state their testimony. We will then, at the end of hearing everyone that's there, so however long that takes, for the people that have signed up to testify, we will then close the public hearing. So that's all. There's no engagement. There's no back and forth. There's no discussion between staff or the APFO committee members. You are just simply taking testimony, basically comments and feedback from the people that are signing up. Then we'll do this again toward the end of the APFO committee once you have your draft recommendations published. And the idea would be then taking public comment. Hey, did we hear you all? Are we headed in the right direction for your recommendations to county council? Because remember, you're not changing the APFO ordinance. You're just giving recommendations to the county council then to use to make the final decision on things. So is that clear? So this is just kind of hearing, hey, this is what we're doing. What do you all think? Do you want to give us anything else we should be looking at or whatever? Drafting the report and then coming back saying, hey, here's what we've done. What do you think?
And I saw the registration at 7 o'clock, I believe it is, the night before the meeting. So are you going to send us as a group some sort of something that says everybody gets 3 minutes to talk, 20 people signed up, we estimate this will take about an hour? Like, I'm all about going into things being prepared.
Sure.
I mean, yeah, I can do things on the fly and I can fake it till I make it, but I'd prefer to be prepared, and I would think anybody here who's going to be there would like to have some context of what to expect. And because it closes at least 24 hours before the meeting, that's plenty of time to
That's just
send
our
something
online
around to
submission.
everybody.
So that's just for people online to submit if they're going to just to sign up to pre-testify, just so it gives us some inkling. We always let people sign up to testify at the actual hearing as well. So more people could come and at that moment in time, choose to sign up to testify. And we would probably close that down if the chair agrees at the start of the public hearing. So we wouldn't continue to allow people to sign up throughout the public hearing. And each person only gets the opportunity to speak once. We don't want them circling back around and then coming to speak again. So that would be how the public hearing would, the pre-sign up, just so we have an idea, and then from being there, I would suggest too, sometimes we've done hybrid public hearings. I do not want to do that. I think it's going to be very chaotic to try to do it hybrid. So we will just be doing it in person only.
So will you be sending us an email that morning or something before? Will we hear from you before the 6th?
As you always do, we will send out the agenda to you ahead of time. It'll be posted. Todd has the agenda, which is very basic. And we will have a script for you all to follow that evening at your place at the dais. And we can send additional instructions if you'd like. But just
All right,
you're just listening.
Linda, can I chime in here real quick? Are we going to have a 3-minute time limit?
Yes.
Okay.
That's what I
We
have.
do also have,
Yes.
we do also have a timer that someone will be running as well to kind of keep things moving along.
And then it does, just like when you're in the Banneker room, green light, getting time up is yellow, and then red, and we get the hook, the stage hook out, and we take you off.
Their questions will be transcribed as a part of the meeting record, correct?
Correct.
Okay.
Lisa,
And I
your
will
hand was
call
up.
each person. So based on how they've signed up, so everyone I've gotten pre-registered and then who's there that evening, I will call them in order in which they registered.
Lisa, your hand was up first here.
Thank you. I want to clear up some confusion because I did take the certification for the Open Meetings Act, and we can talk to each other as much as we want, just not the number of people together that would be a quorum. So
We
if
cannot
any,
talk about the business. No, I took the certification too, and you can talk to other people on the committee. You cannot talk to them about committee
So
business.
Laura is correct. That's ex parte communication, and that's what we want to avoid.
the 3 minutes, the people won't be speaking as a group, right? So it'll just be people will be asked to speak as individuals with 3 minutes regardless, right?
Correct.
Okay, thanks.
Paul Glykoff.
And they can also submit written as well if they'd like to ahead of time.
That was my question. I'm just reading the public hearing notice. And do you or receive stuff in advance? And if so, will that be distributed to us or just made available in the binder?
What we're doing is we are having a meeting after the public hearing, which is November 13th is the next meeting. That agenda, I have all things public hearing to discuss, just a recap of the public hearing, what was discussed. We will try to have as much information that we've been able to distill and give to you, so you'll have all of that. And then we'll be talking about additional future topics for research and also talking about our 2025 calendar. My suggestion for that meeting, if everyone's agreeable and I can get a room, have that person to have those discussions on November 13th.
Yeah, my preference would be to have an in-person meeting as well.
Okay. So we will see what we can do to accommodate that. Lisa, if we cannot get the Columbia Ellicott, let's talk about if there's any other opportunities for other room facilities. So we'll work on that.
Okay. I need to say, Lisa Markovitz, I agree with you on the public meetings certification. So I'm now a little bit confused because it was my understanding as well. You're on mute. You're on mute.
Sorry,
Go ahead.
I was
Yeah.
just going to say, I kind of was writing myself a note to kind of look some things up because obviously we have some differing thoughts that have been expressed that
I thought
I
it was.
thought I was hearing in the training.
I thought that the training was you can't have those conversations when there's a quorum,
Yeah.
but you can have conversations, one-on-one or 1-on-2 or 3-on-1 or whatever, as long as there's no quorum involved. And so if there's
That's
some
what the council
confusion-
has to do even.
Yes, exactly. No, that's
Yeah.
exactly right. So I think if there's some confusion, we need to get clarification, because that's not my reading of the open meetings law, and I know now it's not yours either, Lisa, and I know Laura's is a different perspective and Linda's is a different perspective. So I don't know how we can get some closure on this so we know exactly what the rules are.
I will reach out back to Amanda, who gave you the earlier presentation at the first meeting, and have her just clarify this point.
Okay, that'd be great. Thank you.
Thank you.
Anybody else? We still have a few more minutes, but I think we've pretty much exhausted our time tonight, and I'm really pleased with the conversations, and I think they bode well for what comes next after the education forum that's leading up to our recommendations. So I'm looking forward to it. Anybody else?
Todd, I'd like to intervene real quick. This is Lisa Kenny. We do have that room, Linda, and I'm going to send out an appointment that will say an APFO in-person meeting. That'll reserve the room, and that'll also put that on your calendar as an in-person meeting so everyone's aware.
And that's the 13th, correct?
That's correct.
Okay, terrific. Anybody else, anything, or should we just take a vote?
Wait, I thought the public forum was November 6th, not November 13th. Do I have that incorrect?
The public forum is the 6th, but we'll do it. We will do our meeting on the 13th as an in-person rather than a virtual.
Yep.
Okay, got
So
it.
it's a public hearing, so it'll be a public hearing on the 6th, and then your typical meeting on the 13th, but both will be in person. And so again, we'll send out more info. We will just reiterate to you all public hearing structure, kind of the process of the night. I have an agenda drafted that was sent. Try to get there a little bit early. We'll all set up. We'll go over the room. I'll have all of that in an email to you all ahead of time. And then the 13th will be another in-person meeting, but our typical APFO meeting.
All right. Thanks, everybody. Can I get a motion to adjourn?
Motion to adjourn.
Any
second
and a
it.
second? All right. All in favor? Aye.
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 Any opposed? No. Thanks, guys. We'll see you
Thank you,
all
everyone.
next
See you later.
Wednesday, the 6th.
Good night, everyone.
Okay. Good night.